Mai, thank you so much for joining me today.
Hi, Risa. Thank you for having me.
Today, we're going to talk about ketamine assisted therapy. And this is something that I've been so curious about for a long time now, and I've been reading a lot about it. So I'm excited to talk with you a little bit more and how it can really help a lot of people that are suffering with many, many issues. So, yeah, but before we kind of get into that, I'd love to love to have the audience know a little bit about you and your background, and so we can have some context. So tell me a little
Sure.
bit about your background and how you even came to understand ketamine assisted therapy since it's so new.
Yeah, sounds good. So, yeah, briefly, I am the co-founder CEO of Isha Health. We are an online ketamine assisted therapy clinic with a licensed therapists and doctors. I'm a emergency medicine physician with over 10 years of experience working in multiple emergency rooms and administering ketamine to hundreds of patients. I decided to start Isha Health Ketamine Therapy Clinic after discovering the benefits of ketamine for mental health. But just winding back to where I come from, so I had some unhealthy mental habits prior to founding Isha Health. During the pandemic, I worked as a ear doc and became a new mom, and it was a very stressful time for me. And yeah, with everything happening around me, I felt numb and isolated, which I think in retrospect was my defense mechanism. And despite that, I just kept working nonstop and ignoring my mental health to just get through my days. Having grown up in a typical Asian household, I hated talking about my feelings and past, and never thought about how I could benefit from talking about those things until I had ketamine therapy. It was recommended by my brother actually, and although I have
Oh,
been
wow.
practicing, yeah, that was from my brother. He had a first-hand experience as well, so that's why he recommended to me. And yeah, although I've been practicing as an ear doc for over 10 years and was very familiar with ketamine, and I knew it was safe, but even with that, I was still skeptical if this is actually for me. So I read hundreds of studies on the use of ketamine for mental health and became convinced that ketamine and psychotherapy could potentially transform my mental health. So that's why I gave it a try. And
Wow.
when I went through ketamine therapy, yeah, I know it sounds kind of a little hippie, but I experienced that we were all fundamentally one, and we are all part of collective consciousness. And this is a concept that's called ego loss, which occurs sometimes with ketamine, psilocybin, and ayahuasca, those psychedelic medicines. And this
Ego
changed.
loss?
Ego loss, yeah, that's the word that's been used to describe this state.
And so what does that mean to like someone who's never done any kind of psilocybin or ayahuasca or, I think, yeah, it definitely has a certain, stigma attached to it, I think. And I think that's scares a lot of people,
Right,
just kind of
right.
having these out of body experiences. But what does that mean, ego loss?
Yeah, so just speaking out of my experience, ego loss that I experienced personally was that I felt that I'm still here as a consciousness. My consciousness is still here, but at the same time, I felt that I do not exist in a physical world anymore, and I felt that I am part of this bigger consciousness that's just one, and that's a oneness that I experience. So this dissolution of own identity as one and being feeling that you're part of that something bigger, that is why ego loss is, and that's something I certainly experience as a part of this experience as well.
And how does that help people with breakthroughs?
Yeah. So the way I felt was that because most of the thing that I was feeling was this feeling of numbness and isolation, and by having this living experience of being part of something bigger, that made me feel that I'm not alone. I'm not isolated because I'm part of this bigger being. And at the same time, I was able to talk about those experiences with my psychotherapist who is trained in ketamine therapy, who understands what it's like to go through this ketamine experience. And I was able to talk about this experience, and also I was able to explore my past from a different lens because I have gone through that ego loss experience. And that was really therapeutic because I experienced things growing up in Japan and after moving to America. But I thought that like I sometimes felt sad or felt frustrated, angry, even sometimes. But I thought these are the things that I have to just deal with it and just push through it and
That's
don't.
so Japanese.
Yeah, right. Yeah. Yeah. So yeah, I think that was a very typical Japanese way to deal with it, but it was in the long run probably not very sustainable. And Ketomaster therapy gave me the ability to access those issues and be able to openly talk about those experiences that I never even thought of doing. And just talking about those experiences and framing in a different way was really, really therapeutic for me. And it sounds a little cliche, but I feel like it was a very transformative experience for me.
Wow, that's mind blowing, and especially for those who have never done it before, or like, or perhaps have done talk therapy for many, many years and without much success, or maybe some success, but not the kind of transformative success that people I hear have had doing just a few sessions. Right? That's the incredible power, the power of ketamine. I feel like. Um,
Yeah,
so tell me a little bit. What is ketamine?
yeah. So ketamine is a medication that's been widely used in medicine for over 50 years. So it is listed as a one of the World Health Organization's list of essential medicines, mostly used in OR or emergency department as a sedative or anesthetic. It has been mostly used in those medical settings, but more and more clinicians started to use ketamine for mental health treatment because over the past decades, over a few decades, there are more and more researches showing that the effectiveness of ketamine for various mental health conditions such as depression, anxiety, PTSD, and other psychiatric conditions.
So is it really just beneficial for extreme cases, or, it's even fine to try for mild depression, would you say? Is it, um, yeah, I don't know if there's like kind of an ideal candidate, because not everybody is eligible to do ketamine, right?
That's definitely true. So most of the researches have been done for patients who have more on the severe mental health conditions, usually described as treatment-resistant conditions. You tried medication, psychotherapy, and it still didn't work out. That's a treatment-resistant. So those are the patient population that was primarily researched on. Having said that, a lot of patients who are not quite there yet, but tried talk therapy in the past, didn't quite work out, tried some medications, but suffering from those side effects. They're also trying ketamine assisted therapy for their treatment, and they are getting a lot of benefits out of it as well. So I would say the primary targeted patients with ketamine assisted therapy is still patients suffering from more severe cause treatment resistant conditions, but it doesn't limit the application of ketamine to people with milder form of mental health conditions.
So what about people with, let's say, bipolar disorder or schizophrenia or those sorts of mental disorders? Is it advisable for them to try if they feel like nothing has worked or other medications have not worked?
Yeah, so there are certain conditions that should not be not very compatible with the ketamine therapy, and any form of psychosis or schizophrenia are one of them. So if you have schizophrenia, you should not be getting ketamine therapy. And on the same note, ketamine has unknown side effects such as elevating blood pressure and heart rate, increasing the pressure inside the brain. So there are certain medical conditions such as uncontrolled hypertension or history of severe heart or disease with the aorta. You should not be getting a ketamine therapy without the medical clearance from your own doctor.
Well, that makes a lot of sense. And what if people are on meds already, on some sort of psych meds? Um,
Yeah, so there are certain medications such as benzodiazepine that can reduce the efficacy of ketamine. And if you have other set of medications that you take daily that can also make the effect of the medications even stronger, that can make the ketamine effect longer. So those are medications that you should be holding off before getting to the ketamine treatment. But generally speaking, there is no medications that you cannot take the ketamine with.
Oh, that's good to know. So, as we get older, right? I feel like, especially in our 50s and 60s, many people have been dealing with depression or PTSD for decades at this point, right?
Yeah.
Would you say, is it ketamine assisted therapy can really help reverse it? Is it the sort of thing where it doesn't matter how long you've had depression for? Um, does it literally, is it literally changing the neural pathways in your brain? Like, what's actually happening?
Yeah. So it's actually more, ketamine therapy is more desirable for people who have been suffering from those conditions for long term. Because as I mentioned before, we have more solid evidence for people who have been treated for certain conditions for a very long time period, and you try ketamine and you get better. There have been, for example, with the treatment-resistant depression, 70% or more patients who received a ketamine-assisted therapy after suffering from depression for years responded to ketamine-assisted therapy. So it is actually a recommended, it is a more desirable patient profile to have that to try the ketamine-assisted therapy. And in terms of what is happening in your brain, so ketamine has multiple pathway that is affecting your brain, and there's no consensus on how exactly it works as yet. Having said that, many researchers think that it is the NMDA receptor antagonist working through the glutamate neurotransmitter system, as well as an opioid receptor agonist. Those are the two main ways that works in your brain. And what does it mean in the end in your brain? So ketamine basically stimulates the creation of new neurons in your brain and also the development of connections between the neurons. So why it matters is that, for example, with the patient with depression and other mental health diseases, certain parts of your brain can shrink. And if you give ketamine to those patients, there will be new neurons created and those brain atrophy can get reversed. So that's one thing. And also, depression or other mental conditions tend to cause this habitual patterns of thought, and that underlies the mood and the behavior. And ketamine tends to rewire your brain in a way to break this habitual pattern so that you can get out of those negative cycle of thinking and the mood.
Wow, that's crazy. And I think for many people who have been in those patterns for many, many years, I don't think they could probably even imagine what it's like not to have those patterns, right?
Exactly.
And especially with PTSD, because I know people who have suffered from, like, they don't even know they have PTSD, right? It's so kind of ingrained in who they've become. Um, and so what does like a session look like, or like how many sessions? Like what does it look like, and what does like a breakthrough look like? Is it the sort of thing you wake up and you're like, "Oh my God, everything's beautiful now." Or is it
Yeah,
I'm
so
assuming it's
it's a
not like that.
process, right? Yeah, yeah. So, right, it really depends on the person how they respond to the ketamine assisted therapy. Some people respond actually within a few hours after the ketamine dosing session, and some people, for some other people, it can take a few weeks or so. But relatively speaking, the ketamine is a medication known to act faster than traditional medications, which tend to take months to start taking an effect. In terms of how the ketamine assisted therapy works, there are mainly four components to it when you first start a ketamine therapy. The first is medical evaluation, and the second is a psychological evaluation and preparation, and third is ketamine dosing session, and the last is a ketamine integration session. So how it goes is when you first start the session, you meet with a medical provider like myself, and that is the session to go over your medical history, psychological history, medications, past treatment attempts, and other social histories. And once the medical provider decides that you may benefit from ketamine assisted therapy, you will move on to the next stage, which is to meet with your licensed and trained psychotherapist. So you will meet with the psychotherapist and go over your psychological history, and also to prepare for the session by setting the intention going into the ketamine session, and simply to get you prepared for the experience, give you some expectation on what the therapy will be looking like.
So when you
And
say
after
setting
that,
an intention, what do you mean by that? For those who may
yeah.
not, I feel like sometimes setting intention sounds a little bit woo woo for people, depending, like they're going to go into some sort of meditation. But setting intention, I think, is really important for most things in life, not only for a ketamine assisted therapy session. But can you elaborate a little bit on that?
Yeah, so it will look very different from person to person. People have different intentions to go into the academic therapy, right? So for example, yeah, in my case, when I was feeling semi disconnected or isolated, numb, the main goal from out of this academic therapy was to focus on the end result of those symptoms, which was I felt very demotivated to going to work. I felt that I didn't have a really engaging conversation with my friends. So I wanted to change those things. So I set those very specific things as an intention before going to the ketamine therapy. And by doing so, when you're out in the ketamine dosing session, you will experience a lot of things. You may think and feel things that you never even thought of. And it's really hard to connect those things to your day-to-day experience without setting the intention, like what you want to achieve from those experiences. That's why it's very important to have a set of intention, like why you before you're going to the session, so that you can connect those experience to your day-to-day.
Wow. So what does ketamine actually even look like?
So ketamine looks like this. So it
Oh,
is a tablet, a lozenge. So yeah, I can open it here.
oh, don't take it though.
Yes. I'm not gonna take it now. Yeah, it's a lozenge. It's a dissolvable tablet. Yeah, so it looks like
Wow,
this.
that's very cool.
And yeah, it's just a little powdery tablet that looks like this.
Very cool. So basically you
Yeah,
just put that under your tongue and let it dissolve on its own type of thing?
that's correct. Yeah, so we generally recommend keeping the lozenge in your mouth for about 10 minutes or so, and let it absorb through your oral mucosa, and spit it out after 10 minutes, because when you swallow it, it will go through a different kind of metabolism, and that can make the effects last longer. So yeah, you basically just hold it inside your mouth for 10 minutes and spit it out.
Oh, wow. Right. And the whole point of that is that it gets absorbed into your bloodstream a lot faster, right? Um,
That's correct.
so people can feel effects as soon as how many minutes? Like within what, 30 minutes?
Generally speaking, 10 to 15 minutes. Yeah, 10 to 15 minutes, you start to feel something is happening. And about 30 minutes point, you will start to get into a full experience where you start to feel very different things. And you may not feel like you don't belong to this world anymore, something like that. And that effect lasts for about 30 minutes or so, and at that point the effect of the medicine starts to gets weaker and weaker, and yeah, after an hour, like, you are pretty much back to where you are before. So the total ketamine dosing session with our clinic is approximately 2 hours.
Wow. And so you do this all through telehealth. So you're essentially online with a doctor while you're doing this at home. Is that right?
That's correct. Yeah, everything is online based, and we ship the medications and other equipments to your home. So yeah, you can get everything done while you're at your home.
Oh, wow. That's so crazy. And I feel like that it's such a personal thing that I feel like more people would try it because they're in the privacy and comfort of their own home, right? Um,
Yeah,
but what
exactly.
happens? I mean, do you need to have someone physically there in case something happens? Yeah, I would think, especially if it's your first time.
Yes, yeah. So, right. So before we start the ketamine dosing session, we will have our patient assign one trusted person. We call the person support person to be physically in the same space throughout the session in case something happens in the physical world. Most of the time, nothing happens, and the person will assist that the patient was just bringing a cup of water or something like that, something like. But if in case of emergency, like we will reach out to the person to assist the patient and do necessary interventions.
Wow. And so then, is there a possibility that literally nothing happens? Like you're just there? Or
Um,
generally, I mean, you have a
Most
very high chance
likely
that something
not.
will happen. It may not be as extreme as, having.
Yes, you will. That's correct. Yeah, so you will feel something for sure. And if you're gonna have the full experience to the point that you feel this oneness or ego loss, or you feel just relaxed in some lighter experience, that really depends on how your body metabolizes your medication, metabolize the medications. So that's something we can really predict in advance. Although we do have certain protocols to get you the right dosage, we use the first session to evaluate your response to the medication so that we can adjust the dosage for the second session onward.
Wow, that makes sense. And so, how many sessions does normally someone need to have in order to not be so sad anymore, right?
Right. So most people experience the resolution or improvement of depression or other symptoms within 4 to 6 sessions. And if you do not respond within that time frame, probably ketamine is not right for you. So usually that's the time we reevaluate the intervention to see if you should continue with the ketamine therapy or not. And after that, ketamine usually lasts for about a few weeks to up to a few months or so, depending on how you respond. So that's the maintenance phase that a lot of patients typically go through to have additional ketamine therapy session after this first 6 sessions.
Wow, that's great. Um, so, what would you say is the difference between ketamine and like psilocybin mushrooms? Because psilocybin is like, has such a big buzzword right now too, right? How are they similar, and then how are they different?
They are similar in a way that they can all bring you this psychedelic experience where you experience a non-ordinary state of mind. Um, Psilocybin and LSD, well, not much LSD, but MDMA, for example, they are extensively researched right now, and there is a certain movement for legalization of those substances. And that is because there are a lot of research evidence that's showing the efficacy of those substances for mental health conditions. So, the depression, anxiety, PTSD, having the main one that's being studied among those substances. So that's a similarity. The biggest differences are twofold. One is legality. So ketamine has been legal in America for over 50 years, as opposed to other psychedelic substances are still illegal. Psilocybin will get legalized for medical usage starting January 2023, but other substances are still no set plan for legalization as yet. So that's one of the biggest difference. And the second thing I would say is between psilocybin and ketamine, psilocybin lasts much longer than ketamine. So ketamine experience, as I described earlier, is about 2 hours, max 3 hours. It's very short, as opposed to psilocybin can last several hours, half a day. So you require a lot more time commitment to go through psilocybin or ayahuasca experiences.
Right. And so, and then also psilocybin is a plant. It comes from a plant.
That's right.
Is ketamine synthetically produced, right?
And ketamine is a synthetic substance, yes.
Wow. So, I mean, I guess, but they essentially could both. help cure one's depression or PTSD. They both have the ability to do that.
That's correct.
Wow, that's so
Yeah.
awesome. That's so awesome. Um, so what do you recommend people do, like, if they've kind of been toying around with this idea, like maybe I want to try, maybe I don't want to try, like how do they even start? Like, what do they even do?
Yeah, that's a great question. The first thing I would recommend is to speak to your mental health providers if you have one. Some of them are already familiar with it, and that doesn't mean that they will provide a ketamine therapy themselves, but they may know somebody who can provide that for you. And if you don't have a provider like that, or your providers are against ketamine assisted therapy for whatever reason, you can always come to us. We are online ketamine assisted therapy clinic. All the interactions online. So the first thing you do is to answer some screening questions, and after that you can book the first appointment with me so that we can talk and discuss if ketamine is right for you.
That's great. That's so great. And that's really, really reassuring. But right now, you're only available in California for the time being.
That's correct. We do have a plan to expand to other states later in the year, but currently we are offering cannabis therapy only in California.
So as we kind of wrap this up, are there any kind of final thoughts or like misconceptions or questions that you get that you feel like you want to answer, or just to kind of have people walk away with, you know, real information, real research that's been done? What do you suggest? What do you recommend?
So I am aware that there's a lot of stigma relating to cannabis therapy. There are two components that stigmatize. One is mental health treatment, and two is ketamine psychedelic medicine. So like that's something I had myself growing up in Japan. And it's really hard to find the real information about it, right? Even as a medical provider practicing medicine in America for 14 years, I was not aware of that until I actually started looking for the information. So education is a really big part. We do have the blog post to share the information from the scientific community in a way that's more understandable to non-medical professionals. And there are other sites that's providing such information. So it's good to start reading about those blog posts or articles on it to get familiarize yourself with the cannabis therapy. But I think what I would recommend most is to actually speak to the cannabis therapy provider to get the latest information, and if it's something right for you. Mental health is not for crazy people. Psychedelic medicine is not for crazy criminal people. Ketamine assisted therapy is science validated, very effective mental health treatment that can help a lot of patients who are suffering from mental health conditions. So I would say stay open-minded about this relatively new treatment, and if you are interested, give it a try. Feel free to contact
That
us.
sounds great. So if people do want to read up more about you and Isha Health, where do they go?
Yeah, so our website is at www.isha.health, isha.health. So yeah, all the information is there, and you can book the first appointment with me through the website
Great.
as well.
Mai, thank you so, so much for taking the time. This has been really, really great.
Thank you, Risa, for having me.